हेलो योगेश। यस सर। मैं अभी थोड़ी देर पहले भेजा था, मैं दोबारा भेज देता हूँ।
वो उसी को भेजा था कि एमयू पर डाला था?
उन्हीं को डायरेक्ट उनको डायरेक्ट नहीं भेजा था, मैंने बाई ईमेल भेजा था, मैं दोबारा भेज देता हूँ।
मैं भी इधर से फॉरवर्ड कर देता हूँ जो मैं आपने भेजा था ना, मैं तो मेरा तो ज्वाइन हो गया उसमें।
ठीक है सर।
I forwarded the mail just now to you, and I could join. I could join on that link. So I'm holding. Please try. No, not number. There is a link. You have to click on that link. No, sir. Oh, you say join my computer thing. See, it says register in advance for this meeting, and then registering you will receive a confirmation email. That's all. So you have to put your email ID onto that, and you.
Good evening,
Hello,
sir.
Good evening, sir.
Good evening. Good evening. I was trying to join. Got stuck up. Can you hear me?
Yes, sir.
Yes sir.
Yeah, Dr. Vishnu, I can see you.
Yeah.
I can see you.
Thank you. Thank you.
So we'll wait till 8 p.m. and then we'll start at 8.
Whatever time you say, I am fine.
Just 5 minutes more. Sandhya, you had said no audio. Can you hear now?
I
Yeah, we can hear you, sir, but we can't see you.
Yeah, my video is off, but because I want to save on the bandwidth. And Dr. Vishnu, you have been made the co-host.
Okay. So I can share the screen from here.
You can share the screen. So when Sanjay requests you, you please share your screen and the slides.
Thank you, sir.
Dr. Mahalakshmi, do you have any slide or something you can share?
Your voice is not clear. Mahalakshmi, your voice is not clear. Even your image is static.
Sir,
It seems
Maybe you
your
have
net is some giving problems.
Maybe you have an issue with your bandwidth.
I think you can stop your video if you want.
Yeah, stop the video, just let the audio be on.
Now you try, talk and see.
Yeah, now speak on. Mahalakshmi, speak
you
on.
can hear me now, sir?
Yeah, yeah. Now it's
Yes,
better.
yes.
Yeah. Okay, sir.
You
Actually, I have something written, sir, but I'll read out. I need not
okay.
show that.
So stay closer to the mic, please.
Sir, I'm using earphones only, sir. So I'll try and talk a little louder.
Yeah, that would be better.
Good evening to everyone.
Good evening,
Hi, Dr.
Dr. Atkoli.
Atkoli.
Good evening.
Good evening, good evening. I think Dr. Atkoli is in Delhi.
Sanjay declared winter. Sanjay, you are muted. You are muted.
Amritsar is very cold, sir.
Okay, so time to start now. Good evening, friends. One more month, one more evening, and one more stalwart to share his thoughts on medical education. So we have with us today's speaker and guest of honor, Dr. B. Vishnu Bhat. So I hand over to Dr. Mahalakshmi to please start the proceedings.
Good evening, friends. I would request everyone to put themselves on mute so that the audio quality is good. I welcome you all for this Dr. Rita Sood Memorial Oration to be delivered by Dr. Vishnu Bhat today. It gives me a great honor and pleasure to invite Dr. Vishnu Bhat for this oration because I know sir since the time I was a postgraduate student. In the eyes of the baby, there is joy, there is laughter, there is hope, there is trust. There is a chance to shape the future, and every baby is precious. So actually, this is the heart of Dr. Vishnu Bhatt's work with newborn babies for over 5 decades and more. Dr. Ballabhatta Vishnu Bhatt, Bhatt sir, as he is fondly called in our place, is currently the Director Medical Research and Professor of Pediatrics and Neonatology at Arupadai Medical College, Pondicherry. He retired as Director, Senior Professor and Head of Neonatology from JIPMER Pondicherry, an institute of national importance. Sir is very proud to say that he joined JIPMER as a student and he rose to the highest ranks which is possible within the realm of the institute. Having completed his training in pediatrics from JIPMER in 1978, he has seen the care of children grow and the specialty of neonatology develop both in JIPMER as well as in India. And I can proudly say, including my baby, almost 1/4 of the babies born in Pondicherry have all been blessed by him or touched by him. He has been sent. Sir, can we mute everybody? He has been instrumental to the growth of pediatrics in this part of the country through his vision, knowledge, teamwork, and organizational skills. Upgrading the neonatal services at JIPMER, he introduced the DM and the PhD courses in neonatology, and he set up the level 3 neonatal intensive care unit as part of the Women's and Children's Hospital. Actually, his approach is babies first, right? For quality, safe, ethical, and humane care of patients. That is his passion. And his research interests include perinatal asphyxia, neonatal sepsis, and he has played a very important role in documenting hypothermia in neonatal asphyxia. He has published over 380 papers in peer-reviewed journals, and his research work is widely recognized as indicated by the citations. And he is also the section editor for Indian Journal of Pediatrics. He is a very prolific writer and has edited books titled Protein Energy Malnutrition, NICU Protocols for JIPMER, and NNF Protocols in Perinatology, etc. And his main focus of his research activities is to take science from benchside to bedside to link evidence to practice. So he has encouraged and motivated his young colleagues to push the boundaries and explore new horizons. And he's a very dedicated teacher, and his unique style of patient-oriented discussions have generated enthusiasm and remains a muse for all his students, past, present, and scores of pediatricians across the country who attend the CME programs and workshops conducted by him. He has delivered many prestigious orations. The most recent one was the K.C. Chaudhary Foundation oration by Indian Journal of Pediatrics. And his work in medical education has been very significant, and he is one of the famous 5 teachers of NTTC at JIPMER, along with Professor Anantha Krishnan and Dr. K.R. Sethuraman. He has been an ace performer throughout his career. He has won many awards and recognitions since his school and college days. He has been awarded a fellowship by the National Neonatology Forum and also for the WHO. And he trained in University of Illinois for that. And more than that, sir is a very passionate teacher and compassionate clinician. He's well supported by Madam Dr. Shobha Bhat, who is an ophthalmologist. And sir has a daughter, Mrs. Sushma Ashwin Rao. She is working with Microsoft Seattle. He enjoys the company of his grandchildren, and he spends his free time usually in reading, writing. He practices yoga. He does everyday walking, etc. So, as Albert Einstein says, education is not learning of facts, but training of minds to think. He has remained a legendary academician, a prolific researcher, a clinician of great compassion, and more than that, he has been a mentor and guide and able administrators, and above all, a great human being. He has remained very pragmatic in search of perfection, and he is a man of highest integrity and an ideal role model. And it is indeed extremely honorable occasion for me to introduce her to this forum. I hand over the mic to Professor Vishnu Bhat sir for delivering Professor Rita Sood Memorial Oration. Thank you, friends, for this opportunity. Over to you, Bhat sir.
So, thank you very much, Dr. Mahalakshmi. Always, it is nice to get introduced by your student. Of course, she was a surgeon, I was a physician. And I have to be thankful to Dr. Sanjay Bedi and Dr. Tejinder Singh, who are communicating with me regarding this oration quite often, and all the office bearers of MEU for selecting me for this oration. It's a great honor because Dr. Rita Sood, such a pleasant lady, I have met her quite a few times in AIMS with regard to medical education. I was greatly impressed by her. Of course, she left us quite early in her life. So, what I will be talking on professionalism and ethics in medical practice, because that is one thing which is very close to my heart, as Mahalakshmi knows and Dr. Adkoli knows. I regularly take this class for postgraduates, undergrad students, so that at least some good thing will imbibe. I always tell my students that knowledge need not be taught always, because you can read books, you have computer, you can download from the internet. But the way you behave and the way you treat a patient and your next generation is what is more important. So I will share my slides. Is it okay?
Yes, sir. Can you make it full screen, sir?
Sir, you can unmute yourself.
Now it's okay?
Yes, sir.
Okay. So professionalism and ethics.
You have to make it full screen, sir.
Now it's full screen?
No, sir, it's not full screen. You will have to share screen again and then.
But it is quite visible here. It looks full screen.
Sir, because when you make it full screen, it becomes another screen. And the bottom, can you see there's a at the bottom there is a for making it full screen. You press that button.
No, it is in my this here. Shall I stop share and then see?
Yes, sir.
Bottom, which you are telling?
When you make it remove the full
Sir,
screen, and at the bottom you will see there's a button for making it full screen.
Sir, you can minimize the Zoom window, go and make the PowerPoint full screen, then share the desktop.
So now
You will have to share
Yet
screen
to
again.
start sharing.
is it better? No.
No.
Shall I put in the slideshow and see?
Yes, sir.
Yes, sir.
Is it okay? It has changed here in my computer. Is it visible?
No, it is visible, sir. I think you proceed, sir. No problem.
Okay. So professionalism and ethics for medical practice is a topic. All of us are interested that every person, every doctor should be a professional. He should practice professionalism, and also he should practice ethically. So Carl Jung told that medicine cures disease, but only doctor can heal patients. This we all should understand. It is not the medicine which heals the patient. It can only cure the disease. But doctors are very important, because that is how they come to the normal. So what is the present situation? Everyone feels that the professional ethics are important, but the question is, do we make a serious attempt to train our students to acquire this skill? If not, where does the problem lie? What should be done to improve the situation? So I will describe a little bit about professionalism. I will talk about ethics, and I will also give some situation which I use for group work for the students to
So
respond.
your screen is not moving. It's still on the first slide.
Shall I just get out and come back?
No need, sir. Just to share again.
Sir, close the PowerPoint and redo that process.
Is it okay?
Yes, sir.
Okay.
Yeah.
Perfect.
So what is professionalism? Professionalism basically the competition and skill expected of a professional. So now we need to know who is a professional. A person who is paid to undertake it and complete a specialized set of tasks. Earlier, doctors, engineers, and lawyers were traditionally considered as professionals, but over the years, it has been extended to include scientists, teachers, and artists. Any professional should practice professionalism. That is what we see. If you look at the American College of Graduate Medical Education definition, they'll look at the commitment of a doctor to carry out professional responsibility. He should adhere to the ethical principles and he should be sensitive to diverse patient population. Unless you are ethical, you cannot be professional. If you are not professional, you cannot be ethical. So they are interdependent. Now, looking at the medical profession, the medical council is the one which may be regulating whether a person is professional, practicing professionalism or not. You may have hospital committees, you have your peer groups. All these people will be looking at you because when there's a problem, these are the people who will look at the way you are working. Now, as a medical teacher, we have double role. One, a caregiver, we see the patients, we try to heal their problems. We also teach and we guide the students who are the next generation of practitioners and teachers. Mahatma Gandhi said, students and patients are your customers, but never think they are doing any favor by you helping them, but they are giving a chance to you for serving. So you should get or become happy when people come to you for taking help. So whatever we do when we heal the patient or try to look at the disease condition, whatever you do, it should be evidence-based. And the clinical judgment basically consists of 3 steps. First, we should take a detailed history because unless you talk to the patient and understand the patient, you cannot proceed further. Once you take a detailed history, you should do the physical examination in detail so that you can find out what he has told or what he has responded, whether they match with the clinical findings or not. And you may do some laboratory tests to confirm what you thought is right or wrong. So these steps which we teach the students, history taking, physical examination, laboratory investigation, should be done very strictly. But often what happens, a busy practitioner may go in the reverse order. So he may do first investigation, then he may look at the patient, then it will. So sometimes gets into problem because many times the lab report, there could be some mistake, then you will scratch your head. What has happened? You may not be able to find a solution. So once you make a diagnosis, provisional diagnosis, you should think what can be done to the patient. What is the evidence available with regard to the condition? And what are the treatment options available to you to heal the patient? Once you decide this, you should discuss with the patient because you cannot take a decision to the patient. You can only talk to him, you tell the possible options available, ask him to take a final decision. Otherwise, always there will be confusion whether you have done is correct or not. If everything goes on well, he is happy. Something goes wrong, he will find fault with you. So as a teacher, you should always think what this student of yours should do or in what level he should be competent enough once he goes out of your department or a college. So we develop objectives, teaching learning methods, evaluations. All these should be able to tell you whether this student will be able to undertake the task which he needs to do. So that is our present day competency-based education. When he goes out, whether he can deliver the goods or not. The good clinical teacher should encourage active participation of the student. He should demonstrate positive attitude. He should emphasize on applied problem solving. He should integrate the basic science with clinical medicine. Otherwise, there may not be connection between what he has learned in the basic science and in his clinical practice. And didactic teaching should be minimal or should be reduced. You should closely supervise the students and provide effective feedback. In the present day curriculum also, we talk about reflection, feedback. So they are important. It should be recorded whether it is going in the right direction or not. You should not rely on verbal clinical presentation. You should give adequate opportunity to the student to practice. The teacher should be a good role model in patient relationship. If you do not behave well with your student, obviously your student also will not follow, will have the wrong type of reaction. He should provide stimulus for thought and challenges to the student. And always the teaching should be patient-oriented than the disease-oriented. Same disease may present differently in different patients, and so the treatment required also may not be always same. Always the teacher should be friendly. After all, we are all friends. And he should be like a parent at home. He should be helpful. He should always be available. When the student is in problem or distress, the teacher should be there to help him. Now, all of a sudden, why this professionalism, interest in professionalism come? One is drawback of the high-tech medicine. All investigations are available. So many people may feel, okay, let us get the investigation. The lab reports will make a diagnosis. Why waste time on taking a history, talking to the patient, and examination? Commercialization and decline in values. This happens because there are a lot of money spent on getting a medical education. So they want to earn and get back the money. So sometimes the practice may not be completely ethical or professional. Growing consumer awareness, because internet is available, all informations are available. So the patient or their relatives will also look for various issues in relation to that disease. So this develops sometimes the mistrust on the public on the doctor. And they also know that after all, a doctor is a human being, so he can make mistakes. And many times some patients may come only to create problem. That also may be there. So we also have to compete with the traditional healers because sometimes they may be more popular than a well-trained doctor. So we should try to regain the time-honored reputation of the medical profession, and this should be told to the student and in both action and knowledge. The fundamental principles of profession is that as a doctor, primacy of patient welfare. We should focus on the attention, trust, and patience always should be the supreme. And always think patient is a separate individual. He is not part of, he has his own autonomy. So you can educate them, you can empower the student, but never take a decision to a patient because it is not your body, it is his body. Finally, he has to take a decision. And always think of social justice because we have different social status and whatever resource available, it should be distributed for the benefit of all. In our life, if you look at the professional life, initially we are junior, so patients may not come. So there is no work, you have no money, but plenty of time, you don't know what to do. But as the days pass, you will get some work, some money, and some time. But when you climb the ladder, you will have plenty of work, no time for anything, plenty of money. So this is the life history of everybody. So from the initial stages to the later stages. This is one of the example for a group work which I usually use in a crowded OPD. A poor patient's turn is for consultation. You are seeing patients in a queue, and next patient probably is waiting with the breathlessness and chest pain. But when the patient is supposed to come inside, a well-connected person enters your chamber and wants advice regarding medical reduction, weight reduction. So I ask the students, what will you do in such a situation? Then we'll try to tell them that you convince the VIP or the important person, the other patient is very serious. So I will attend to him and discuss your weight reduction later. But he is not in a good mood to listen. Then give the patient who is sick to another colleague and talk to this person. So this type of situation happens sometimes in our outpatient. Now 1 to 2 p.m. is your lunch time. A child will see where dehydration comes. Now the question is whether you will go for your lunch or treat the dehydration. So some students will say, sir, I will go for lunch and come. Whereas others say, no, patient is serious, patient is very important. So you should see that the patient gets the sufficient care. Even if you are going for lunch, you should hand over to another person, or you write the intravenous fluid, the nurse or other person can administer that. You can have your lunch and come, or you wait for the next duty doctors to come before you leave. Now, sometimes you want to do research, so you want healthy volunteers. You look here and there, you don't find anything. Then you call the students who are in your care. You say, I am examiner to you. So anybody doesn't want to participate in the study, I have no objection. But please, those who are willing, you sign the informed consent form. So you find that no student, if your examiner, will have the guts to say, okay, I will not participate in your study. So this is unethical. We should tell that normally what we say is that either you use the students who have passed your examination. Suppose you are a second year teacher, you take third year, so who are not under your control, except probably in medical education. When you want to do a medical education study, you cannot take another group. You have to take the same group. It may be an exception. Otherwise, usually you should not include students who are under your direct control for any research work. Now, sometime all of you must have faced this situation. You are in examination, but some students perform badly. But there will be so a lot of pressure from behind to pass the student, either by phone or physical, whatever it is. So normally it becomes a problem. So normally what I do is I explain to the situation. Suppose I pass, he will not only become dangerous to society. Tomorrow you become ill, this person may have to treat you. So you should be careful in passing. So it is not against the student, but against his performance. So you should explain and make them understand rather than giving a pass. Now coming to the key points of professionalism, you should have respect for others. You should have humanistic qualities, compassion and empathy, which should be taught to the students. Honesty, integrity, ethical and moral standards should be maintained. You are accountable to the society as well as your profession. You should commitment to the service you as in the duty and while advising. Should be a good communicator and collaborator. Lifelong learning, which medical council now stresses on it. So absence of self-interest and altruism are important. Now, the problem in professional is, first of all, defining profession. What I think is professional may not be professional for another person. So the definition itself is a problem sometimes. When it goes outside too much, then everybody says, yes, yes, there is a problem. Difficulty in measuring the behavior, unlike signs, symptoms, or drugs to be given, that is easy to measure. But professional behavior is not that easy to measure, because you should be continuously observing the person. Factors beyond the control of the teacher. Sometimes the students may be backward in studies, personality problem may be there, parenting problem may be there, schooling, social criteria, lot of other factors which beyond medical education may be there. You have to consider all these factors while training the students. Many times the student may not find a very good role model. The seniors himself may be doing wrong. So how do you expect the student to do better? So professional has to be taught, but should also be observed whether it is being learned or not. Now coming to ethics, the 4 universal principles of ethics, all of you know, so I need not have to tell: autonomy, justice and equality, beneficence, non-maleficence. Do good to the others, never do harm to others knowingly. Sometimes mistake can occur. Always maintain justice and equality. And other individual has got an autonomy that must be understood by the other person. And we add confidentiality to this, because as medical professionals, we have a responsibility of maintaining confidentiality. This cannot be breached. Now, some examples. You are not getting enough participant for your study. You want to do a study. Then you tell them that I will give attractive gifts. I will give compensation in the form of money. I will bring you here to the hospital. I will take you back. I will give you food, everything. So this is what's called as inducement. The ethical committee has to look into that whatever we give compensation should be reasonable. It cannot go beyond where it becomes an inducement. Now you want to conduct a trial on a drug. You know there are some side effects. Not that we don't do studies with some side effects. It should not have major side effects. Always remember that you should not do harm. If at all, you cannot do good. So whenever you take consent, whatever minimal side effect is there, that also to be told to the participant and take an informed consent. It's very, very important. So as teachers, we often focus on explicit curriculum. So the medical council has listed this. So you tell all these. But the student listens to you. He writes in the examination, but he learns from what we do. So the hidden curriculum is very important. So if you want to change our students, then we need to change ourselves first. Otherwise, it is not going to work. Often there is a tendency to underemphasize the personal characters like professionalism, ethics, and we overemphasize the more easily measured academic achievement. So whether he passes over, whether it's gold medalist, first class, but what he does, we often do not measure. That is the problem. So how it should be taught? There should be a source of credibility. The person who is teaching should practice what he is talking. And he should be a role model and monitor whether it's going on well or not. There should be continuous reflection, and you should give opportunity to demonstrate the skill to the student, by the student. And you have to do formal and informal assessment you should do. You should also look at spiritual development, which is equally important, not only academic information. You can give simulated patients, you can have small group discussion. So various methods we can use. Dolly Parton said, the way I see it, if you want to see the rainbow, you have to put up with the rain. So you cannot sit in your house, inside the house, and see the rainbow, just like I see from outside in the rain. So you should get drenched, then only you will see as I am seeing. So look at these birds, the penguin. The mother one is telling the baby, smaller ones, how to fly. So it gives a introduction, then it starts flying. Now you follow me. This is what a teacher should do. You do, then you give examples, then he make them to observe and learn. So we teach the students ideal, but they often learn from real. They observe what the teacher is doing, then they learn from that. So lack of professionalism may come when there is abuse of power with your colleagues and patients, which we should be very, very careful. Whether colleagues or patients, all are important. Everybody is a human being, so that respect has to be given. There could be sexual harassment at any cost. Even if it is not there, sometimes complaint can be there. So you should be very careful when you are dealing with a patient of another sex. There can be a breach of confidentiality. What has been told to you as confidential information, if you divulge, it also becomes wrong. And sometimes there may be arrogance, like a display of superiority, self-importance. This may create problems. There could be greed for money, power, promotion. So many things could be there. Sometimes consciously a person may misrepresent fact because he does not want to tell the truth. Physical and mental impairment could be another cause of in the individual. Lack of consciousness, and sometimes there could be conflict of interest. Most of the journalists, they will tell whether there is any conflict of interest. Many people write there is no conflict, but without knowing what is really is conflict or whether it is really there. So the conflict of interest should be always nullified. In Toronto, 2001, they have done a study. 47% of the students were under pressure when they did unethical practice. And 61% of the students told they observed the teacher doing the same thing earlier. So as teachers, it is our responsibility that we practice both professionally and ethically. Now, another example, you conduct a research project, but the outcome is not as per your expectation. But medical council and your institute wants publication. They say you publish, and unless you publish, you will not promote. So you alter the values and publish a scientific paper. Paper gets published already. Then later people realize that you have altered the values. Suppose if they ask raw data, then you should be able to provide the raw data if there is a confusion. So this may sometimes happen in research. Sometimes pharmaceutical companies may approach you for conducting clinical trials. Many times they will tell, this is what you expect, and the results should be as we expect. If the results are there and we can promote our drug, we will give you foreign tour, we will give the gift, all those things. But you should never fall prey to this type of things, because later it will create problems. Somebody will find out what you've done and it may create problems. Now, a professor conducts a study. His wife and child require promotion, publication for their promotion. They may not be connected with the study because they are in a different department. They may not have come in contact with what you have done. But this professor may add his wife and child as a co-author. This is also unethical. If a person is not connected with the study, normally good journalists will tell you what is the contribution of each author. Of course, you may write anything, what has been done need not be told. So, a roadmap for professional ethics, you should set up expectation. What you expect out of the student when he goes out. Create an environment for promoting professionalism and ethics, and you yourself become a role model. So you set up an expectation, create an environment, develop a role model, and then you assess whether it has been done or not. So the education of a doctor, which goes on after his degree, is the most important part of his education, because we deal with patients more, public more. So every day is a learning experience. So social accountability always should be stressed. Obligation of the medical schools to direct their education, research, and service, whatever they do, it should address towards the problems of the society. So we do some research which has no relevance, then probably it's a waste of money. The core values in professional ethics issue, whatever it is, should be relevant, quality should be maintained, equity, and cost. So often we should ask the question, are we addressing these issues as a teacher or a practitioner? Now, how to assess the profession? I told it is difficult to assess. So what elements should be assessed? Should it be continuous? I say it should be continuous. 360 degrees evaluation should be done. It should be a multi-dimensional approach. Formative and summative level should be assessed. And workplace-based assessment is ideal. So it should be continuous assessment. Reflection should be there. Feedback should be there. This is a famous Miller's pyramid. So all our students should be at the dust level, not below that. So we can use different methods. We can have peer review. Others can give feedback. Direct observation can be done. This observation can be done by the patient, can be the paramedicals, colleagues, seniors, juniors, anybody. And we can develop OSCE stations. Standardized patients can be given. Student evaluation forms can be used. Teamwork exercise can be given. Mini evaluation exercise. You can also videograph the activities of the student and then replay and show what were the mistakes has been done, how to improve on it. So professional action, the knowledge, skill, attitude, we have to define. We should develop methods for imbibing these, whatever you have listed. Then you should take feedback, whether it has reached the appropriate level or not, then take further action. So it should be a continuous process from the day he joins till he goes out. Not that after he goes out, we'll leave him like that. He should continue to practice what he has learned. So lifelong learning and continuous professional development are very important for a medical practitioner. In a modern medicine, super specialization will come. So compartmentalization. Earlier, MBBS doctor means he's a big man. He will do everything, starting from surgery, medicine, everything will be done. So compartmentalization, the problem is that the care also becomes compartmentalized. Suppose you tell you go to a peripheral doctor first, then a specialist, then a super specialist. The patient also will think, why I have to pay 3 people? Why not go to the super specialist first? So if he has got some problem related to the nervous system or brain, he will straight away go to the neurologist, although it may not be any major issue. Faculty reward system also makes change the behavior. Publish or perish. Keep publishing. Make number of papers. What you have done, nobody bothers, but how many papers you have published. There could be a generation gap. The role model may not be okay. So how can we be more accountable, addressing the health needs and tailoring our duties and services for better health outcome? Reflecting on our routine, you should focusing on the relevance, quality, and equity and cost of treatment and education, what we are doing, and extend the horizon beyond the routine. Whether we can do some innovation, whether we can improve the service, what can be done. So it's a continuous process. So to conclude, professionalism and ethics are important components of medicine's contact with the society. We need to make a good decision to our patients and students. Both are important. Students also important, patients also important. We need to apply these decisions professionally, and we need to be vigilant and sensitize our students and trainees so that they will be perfect when they go out of your department or the institution. So I end with William Osler's quote, quoting from William Osler. A good physician treats the disease. He focuses on the disease outcome. But a great physician not only treats the patient, but also he cures the treats the patient who has the disease, not just the disease, but also the patient. So thank you very much for your patient hearing. And although oration, there are no questions allowed, but you can ask any questions if the organizers permit. So thank you very much once again. And my respect to Dr. Rita Sood once again, and the organizers who have invited me to deliver the talk, and all of you who have listened to me. And there is no copyright. Whatever examples I have given, you can use for training your students also. Thank you very much.
I hand over to
Very
Sanjay
much,
Bedi
sir.
for giving Professor
Yes,
Vishnu
sir.
Bhat the
Sir,
certificate.
one question is there, sir.
Yeah.
Could we take a question? This is from Dr. Tara Shellal. She says, can teachers teaching professionalism recite to the standard knowledge part alone in an environment where unethical professional behaviors are the norm? Very loaded question, I feel. Over to you, sir.
That exactly what I was trying to say, that we should regularly introspect ourselves. Are we doing the right thing or not? Suppose by mistake something has gone wrong, we should admit what has gone wrong and try to correct it. Obviously, if we are not doing the right thing, we cannot expect our students to do better. Have I answered the question?
Yes.
See, you may think others is non-professional.
Now
Yes, sir.
I confer on behalf of MU India and its team. I take great pride in conferring the Lifetime Achievement Award on Professor Vishnu. And also we confer the Dr. Rita Sood Memorial Oration for delivering this talk. We are really thankful to you, sir, for this excellent talk.
Thank you very much, sir.
We generally do not ask any questions, more questions. So now we end the session. Thank you, sir.
Thank you. Thank you.
Good night,
Thank you
everybody.
very much, sir. Thank you, sir. Thank you, Dr. Bedi, for the opportunity.
Thank you, Dr. Mahalakshmi. Thank you, Sindar, sir.